Good afternoon, everyone. Thank you so much for taking the time to be with us today. For all the nurses who are taking time on your days off to come and speak and to watch this program, thank you. I know that you all have so much on your plates, and thank you so much, the elected officials who are on this call. We know that session has been incredibly busy, and we're so thankful for the time that you're spending to hear directly from MNA nurses about what's going on in hospitals and from a patient who can tell you this really important perspective. So this is our 2023 Legislative Town Hall. And if, Cara, you want to go to the next slide, please. We just want to start with the agenda. So we'll start with our president, Mary Turner, providing amazing opening remarks. Then we'll go into the content of the program, sharing nurse stories. And we ask that you please wait until all of the nurses are able to finish their stories to then have open time for questions from elected officials. And then we'll have our closing after that. Next, please. And just a few housekeeping things. If you have questions, please write stack in the chat and we'll call on you in the order that you are on stack. And please keep yourself muted until you're called upon to speak. It's really hard to manage a program when all the folks aren't muted except for the speakers. So we just ask for these two small pieces in order to ensure that we have a successful program today. And at that, I'm going to turn it over to President Mary Turner to take over the program for the day.
All right. Good afternoon, and like Katie said, thank you for all taking time out of your busy schedules to meet with us today. As she said, I'm Mary Turner. I'm president of the Minnesota Nurses Association, but more importantly, I'm also an ICU nurse at North Memorial in Robbinsdale, Minnesota. And we've invited you all here today to hear directly from nurses about what is happening in our hospitals across the state and how you as the legislators and elected officials can help us to solve the healthcare crisis in Minnesota. At our last town hall, which was in December, as you know, we were still at the bargaining table. For months, nurses across the state tried to work with our employers to come to an agreement on staffing language in negotiations. Hospital executives told the nurses over and over again that they would never agree to the sort of staffing language in our contracts and that they would have to be directed by the legislature to do so. So this is where you all come. And so here we are. Oh, got a little bit. So here we are asking you to help us solve the healthcare crisis in Minnesota. In a few moments, you'll hear stories from my fellow nurses about why the Keeping Nurses at the Bedside Act is so integral to the solving that crisis. You'll also hear from a patient who represents thousands upon thousands of patients for whom we are trying to provide the best quality care possible. And later, you'll hear from nurses from Fairview and Sanford Health Systems who will talk about the proposed merger and how it will affect the nursing profession and patient care in our state. At the end, we'll have some time available for you all to ask questions. So again, we appreciate your time and support. Now it is my pleasure to pass it over to the MNA member, Tesh Schlicksup, a nurse at Fairview, who will share more with us about staffing in our hospitals.
Hi, my name is Tesh Schlicksup, and I've been a nurse with Fairview for 10 years. In that time, I've seen staffing resources slowly stripped away to the point where working at the bedside is almost unmanageable. A recent shift, I was training a new nurse to my unit, and during that shift, the management didn't staff enough nurses for the patients that we had on the unit, which resulted in the charge nurse having to tell this new nurse that she had to take a whole independent patient assignment while I also took a full assignment. This is not an ideal learning situation for a new nurse and was extremely hard for me as I juggled a full patient load on top of training and trying to be a resource to this new nurse. As you can imagine, the work on a cardiac unit, which is where I work, is a really busy, intense place. Nurses and healthcare workers are taking to patients taking patients to multiple tests and procedures daily. They need continuous monitoring and intervention on their vitals. But when you have more than your full patient load on top of training somebody else, it's literally like being pulled in 1,000 different directions and failing everyone. All nurses, including myself, pride ourselves on giving the best patient care, not just like a small percentage of our time or whatever we can spare. When I feel like I can't give my all to my patients, I feel like I am failing them terribly. And I go home after 12 hours with no breaks, terribly worried that I missed something really important. And just because I didn't have enough time to dedicate to their care. After so many years of working in these conditions, I've just honestly grown accustomed to it, to working with insufficient resources. But that's really unacceptable. And it's unacceptable for us and our patients. For the past 10 years, I've participated in the meetings with the hospital about staffing levels. Nurses come every year pleading their case and voicing their concerns for the nurses and our patients, but management doesn't really seem to listen. Rather, they continue to reduce and cut staff, increasing patient loads, patient assignments and nursing loads. And as nurses are kind of just left to figure it out. Turnover and burnout are happening at my hospital and at every hospital in the state. I see the impact of these changes every day as we don't have the resources, which is leading to high turnover and burnout, causing moral injury and impacts to our mental health, especially in the last few years. If management was serious about nursing retention, they would be making these changes that nurses have been pleading for, but they aren't. Patients and healthcare workers need lawmaker intervention to ensure nurses have a voice in patient care and in a space that management must actually listen. These conditions in my hospital are unsustainable and will only continue to deteriorate if lawmakers don't step in and pass the keeping.
All right, thank you, Tess. And now we will hear from John Welsh from Unity Hospital. John?
Hi, thanks, Mary. I'm a floor nurse at Allina Health's Unity Hospital in Fridley, and I've worked on the cardiac floor there for nearly 12 years. I just want to say I love my job. I love working with our patients, but there are simply too many shifts where we nurses cannot provide a safe level of care. Shifts where we just don't have enough resources to make sure that 80-year-old woman who is incontinent gets changed in a timely manner, or that we go home wondering if we didn't spend enough time with a vulnerable patient whose condition may be starting to deteriorate, or just the daily stress of helping a patient to the bathroom and then hearing the alarm of a confused patient go off and just counting the seconds, sometimes turn to minutes as that alarm just keeps going before another staff member can safely respond to that patient, and you're just hoping that staff member stays on their feet, or the patient stays on their 2 feet. Or what has happened to me several times in the last several months is that where I have a dying patient who's alone and has no family at his bedside, and the ache in your heart at the end of the day, when other patients have absorbed so much of your time and energy, and you just wonder, did you spend enough time with that dying person so that their final hours could be as comfortable as possible? Nursing research calls these types of situations moral injury. It's when we are unable to provide the level of care for our patients that our moral conscience says we should. It's what drives nurses out of the profession. I've seen it firsthand. Since the COVID crisis, nurses have been leaving my hospital and my floor in waves. In 1 year, I watched my seniority on my floor rise from the 15th most senior nurse to the 5th most senior nurse. So that means in 1 year, 10 nurses with 10 or more years of experience left my floor. There's no other way to put it, but that loss of institutional memory and bedside experience had an impact, negative impacts on our patients. During a Senate hearing this week, a lawmaker asked, why can't the hospital leaders and nurses just work together to find a solution to this staffing crisis? And I can tell you clearly, we tried. I was a member of Unity's MNA negotiating team during the contract negotiations with Allina. We tried so hard to address staffing during negotiations, that time after time, proposal after proposal, we just met with a brick wall of resistance. For the first 8 months of negotiations, they did not present a single responding proposal on staffing to us. We made more than 24 different staffing proposals during the negotiations. In the end, our contracts do make some small gains on staffing. No argument about that. At the lineup, we outline a process where a nurse can object to an unsafe staffing assignment. At M Health Fairview, they gained a provision saying that the floor staffing grids cannot be worsened without an agreement from nurses. These are important, but they do nothing to reduce the overall staffing crisis that we are facing. This week, we've heard from hospital officials tell lawmakers that what the real blame for the staffing crisis is nurses like me for working less than full time. I work 7 shifts every 2 weeks. I used to work more, but I simply was burning out. Too many horrible shifts, and I could not recover in time before the next shift. I actually have a part-time nursing job that pays less than my hospital job, but to me and others like me, it's worth it because the stress levels that we face under the hospital are just simply too much. For our patients' sake, we need to fix this staffing crisis. Keeping nurses at the bedside act, I think, is a common sense approach that brings nurses and hospital leaders together to ensure patients receive dignified and safe care. It will allow us nurses to return and stay at the bedside and focus on the jobs we have. Thanks for coming today.
Yep. Thank you, John. Next, we have Susan Wormter, a retired nurse who will share more about workplace violence and how our bill will help solve this major problem in our hospitals. Susan?
Hello. My name is Susan Wormter, and I'm a registered nurse. I've worked in a hospital setting for over 30 years, specializing in child and adolescent mental health. I retired in November 2022. However, I had originally planned to work longer than that.
Oh, that's my Bluetooth.
When I envisioned retirement in January 2024, I thought I would retire with my Social Security and stay on in a casual nursing position to cover insurance costs. I had to say goodbye to that plan. My last shift in November, 3 staff were assaulted midway through the shift. I just felt like a fool. Everything just fell away, and I realized I had been continuing to go back to work at that hospital, where for the last 2 years, I had seen more assaults to staff than I had seen in all of my years of nursing. They were serious assaults, including black eyes, broken facial bones, neck and shoulder injuries, and concussions. I was seeing this happen to my colleagues, which means so were the children and adolescents on the unit. They witnessed trusted staff get hurt, and that's scary. At the core of this problem was staffing. The hospital administration created and exacerbated the situation. There were distinct changes in how they approached nursing and patient care. Hospitals no longer wanted to partner with nurses. We used to have meetings meant to problem solve issues together. These were discontinued. They changed the staffing grid without nurse input, and which led to fewer staff overall. This meant that each nurse received a higher patient assignment and therefore had less time to spend with each patient. More patients and fewer nurses mean patients have poorer outcomes. And especially in mental health area, less time with patients also means more violence and self-harm on the unit. Healthcare corporations are making hospital work less attractive to nurses. After my experience, I can't help but see healthcare corporations as a threat to patient and staff safety. They are businesses first and foremost. Nurses are providing the best care they can despite the administration. To improve this situation, the administration needs to accept that they hire nurses not to be drones, but to be active leaders in safe, patient-centered care. That is what we are trained to do. On day 1 of our nursing training, we begin cultivating our nursing judgment, learning to constantly assess, to develop a plan of treatment and actions to carry out that plan. Our assessments justify our decisions and actions. When we go to doctors and managers, we can justify our asks, which are always guided by patient care and safety. This is a nurse's top obligation. The hospital stopped following previous contract language, so I truly believe the only way for the hospital administration will accept nursing judgment as a guide to proper staffing is to require them to do so. Nurses' asks for staffing are based on what we see on the unit. Who do you trust? A manager on call with a grid who is not even in the hospital, let alone on the unit, or an experienced nurse who is there with you or your family member? I know who I trust. When I retired early, I took a financial loss that I could ill afford, but I gained much more. I gained peace of mind from knowing that I don't have to go somewhere where I can't provide the best care to my patients because I have too much work and not enough time. And that's the kind of thing that gives nurses nightmares. I also gained peace of mind because I don't have to go to work in a place where I'm likely to get punched in the face or perhaps something worse. I do worry about the future of nursing when nurses half my age are planning their escape routes and cutting their hours so soon in their careers. Nurses don't need our work to be easy. Nurses never expect that. Nursing is a tough job. What we do need is to be able to do our jobs well. Please demonstrate that you value high standards for patient care and will invest in the nurses that provide it. I walked away. Others have too, and more will if changes aren't made. The healthcare corporations won't do it of their own volition. We need legislation that will give nurses a seat at the table to help improve patient care in our hospitals. We need legislation that will prevent nurses from being assaulted at work. We need you to pass the Keeping Nurses at the Bedside Act to help solve the nurse staffing crisis in our hospitals. The public trust lies with you. Thank you for the opportunity to speak with you today.
Thank you, Susan. And I'm going to just go off script a little bit here just to inform the legislators that it's very important to know that this legislation, even though it came from a nursing union, this legislation will help hospitals whether they're union nurses or not. And so that is very, because I don't like it when they make it sound like it's just a union business. There's a lot of hospitals around Minnesota that are not union that desperately need our help also. So with that, thank you, Susan, once again. I'd like to next introduce Stephen Romanesco, a frequent patient in Minnesota hospitals who was so graciously willing to share his experiences with our healthcare system. Stephen?
Thank you so much. Good afternoon, everybody. First off, thank you to MNA for inviting me to speak today. Nurses have saved my life more times than I can count, so I'm very honored to be with you all today. My name is Steve Romanesco, and I was asked to speak to you all due to my extensive experience and difficulty with the current healthcare system and how the Keeping Nurses at the Bedside Act can help improve this system. At 34, on top of my career in higher education, I've been a professional sick person for over 2 decades now, since being diagnosed with primary sclerosing cholangitis, a progressive liver disease that's brought with it 2 liver transplants, and ulcerative colitis, an irritable bowel disease that caused my colon to need to be removed. As you can imagine, I've been a frequent flyer in the hospital for most of my life. Simple fever for me, or for most, causes a trip to the emergency room and generally a few-day admission in the hospital for me. Over the past year, I've been to various emergency rooms across the metro area 4 times for various reasons. At all of these visits, I noticed nurses dealing with greater patient loads than I was used to, and in cases of admissions, a much greater wait time to get into the hospital. I waited in the ER waiting area for 8 hours one visit, and others I waited in an ER bay for 24 to 36 hours, depending on the visit, for a room to open up for me to be admitted. Once on the floors, I noticed patient rooms sitting empty due to lower staffing levels, while my nurses had greater than normal patient loads in double rooms. Rarely when I go to the hospital do I fear for my life. However, lately, that hasn't been the case. I was not receiving the best care I could because of the stress on our medical system and on some of the most important pieces of that system, our nurses. It's clear to me that we as a society need to take better care of our nurses who have given so much to us and have been so critical to my ability to survive and thrive. The Keeping Nurses at the Bedside Act does just that, helps set safe staffing levels for critical care patients such as myself, keeping patients out of hallways and ERs, which I've seen plenty of lately, preventing violence to nurses, and strengthening the education to nursing pipeline. I urge everybody on this call to support this critical bill for all Minnesotans. Thank you so much once again.
Thank you, Steve. Next, we would like to turn to the proposed merger between Sanford Health and M Health Fairview. First, we'll hear from Sandy Anderson, a nurse from Fairview Health East. Sandy?
Thank you, Mary. My name is Sandy Anderson. I've been a nurse. It'll be 43 years in May in a variety of systems throughout the Twin City area and a variety of roles. You could say that when I started my career in 1980, there was probably a hospital in every few blocks in downtown. The systems have merged and created their conglomerates and monstrosities that we're dealing with now, where there's monopolies of a few that are controlling the care for all. I speak not in favor of Sanford coming in and trying to merge or essentially take over Fairview M Health system. When we were in contract negotiations, which were very, very lengthy, we found out, the nurses found out the same time the public did by reading an article in the paper. It was never brought up, it was never discussed. When our negotiating team questioned our leaders, they had no idea. They could not provide any information. The guarantee that we have in recognizing our contract is just that they will recognize it. And so we don't have a lot of trust that they will actually adhere to our contract and actually provide us with the language and the protections that we have negotiated. We've heard horror stories from other systems, whether it be Worthington or up in Bemidji, where once Sanford comes in, it's just a battle. You're hanging on to whatever little bits you have to protect your practice and your patients. I also work in labor and delivery. So we take care of mothers and families that come in their highs as they're bringing in this new life into the world that they are just so excited. And then we have the lows where that heartbeat was lost. There is no more movement. And that fetus at whatever week gestation, now they need to be induced to safely deliver that baby or that fetus before further harm comes to them. Sanford comes from an anti-abortion state, very pro-life, legislation's being passed to prohibit uses of certain medications. What is the guarantee that we'll be able to provide that safe practice for that mother and that family that comes in that dire need, that situation where they have to safely be able to deliver that loss? I don't know. I find it frightening. We also have well-known programs for our gay and lesbian and transgender population. What's going to happen to those? Pretty much in South Dakota, you really don't want to say that you are a member of that community because the governor is very outspoken against. So I speak against Sanford. We know that as partnerships occur, they do not do the community any justice. And we can even just look at our most recent partnership with Fairview and Health East. We've lost services, we've closed 2 hospitals, we've lost mental health, we've lost home care. It's not good for Minnesota. Thank you.
Thank you, Sandy. Finally, our last speaker today was unable to join us live and instead shared a video with her remarks. We'll now hear from MNA member and registered nurse Marina from Sanford, Bemidji.
Hi, and good evening, everyone. I'm currently at work, but I felt strongly enough about the proposed Sanford-Fairview merger that I wanted to speak up and share my thoughts and feelings with all of you. My name is Marina. I have worked for Sanford Bemidji for 10 years, the last 4.5 as a registered nurse and a certified nursing assistant previous to that. I've said it before and I'll continue to say it. Nursing for me is not a job, it's a vocation. I love taking care of my patients and their families. I love the community that I live in.
And pay nothing for a year.
At Sanford, I have seen so many dedicated nurses and nurses aide leave the bedside completely or leave to work for other companies. I do want to be clear here, I am not anti-Sanford. I am pro-excellence and accountability, especially for large corporations. Mega corporations are a big problem in general. Federal anti-monopoly laws do exist for a reason. Yes, we do need growth, especially in small communities like ours. However, there is such thing as getting too big for your britches and having too much power. With growth, so many details get lost along the way. In the case of healthcare, those details are time spent with our patients and quality of care. Patients and employees alike also become nothing but numbers, and we are left optionless and replaceable. Numbers and facts don't lie, we all know that. The fact is mergers similar to this lead to negative outcomes for patients, employees, and the communities that they're in. The only ones that benefit from mergers like this are upper management with their multi-million-dollar paychecks and bonuses. Sanford Health and Fairview have made this merger seem so appealing and positive for all involved. It's clear, however, Sanford is sharing a false narrative. Sanford says one thing, but then does another. For example, for transparency purposes, Sanford launched a website detailing current MNA nurse contracts. However, the language used to describe nurses frames us as greedy, money hungry, unreasonable, and that we are in fact the cause for rising patient costs. Let's not forget these same executives are the ones that were calling us healthcare heroes just a year ago. Sanford has said that they want to invest in the local staff and community. Our hospital has not one but 2 local nursing schools that can feed employment. However, Sanford has shown time and time again that they have no real interest in keeping jobs local and in the community, and is making minimal effort to retain local staff. On their website, they also stated it was a myth that they would be bringing in international nurses, when we were just informed that they are in fact planning on bringing in international nurses within the next year or so. We're already relying heavily on temporary travel positions, and even so, we're still working understaffed. Recruiting and retaining permanent local staff is imperative to being able to provide safe and quality care for our patients while keeping our local economy strong, as well as having a strong foundation to build on. I'll be frank, I do still fear retaliation for speaking up and speaking out, but when I took my nursing oath, that involves advocating for my patients, for this community, and for my coworkers. This merger should not move forward. Instead of seeking a merger, Sanford should instead focus on recruiting and retaining local nurses. I urge you to support our local nurses and patient community by opposing this merger, and instead support legislation to provide critical public oversight for this and other healthcare mergers. At this point, Sanford is trying to build the Acropolis on a foundation of toothpicks. I do thank you for your time. Have a good evening.
Thank you, Marina. One thing I would note, I wasn't able to get up to the AG's Bemidji hearing that he had, but from my understanding, there were very few nurses that had felt like they were safe to be able to speak out at that hearing for fear of retaliation. And I just thought that the legislators on the call need to know that they feared for their jobs. It was my understanding that they were able to pull the AG aside after it was done, but they were very, very reluctant to stand up in front of the CEO of Sanford and have their say. And that is alarming to begin with. So thank you all to all the speakers for sharing your stories, and we'll soon open up to the legislators. As you have heard, it's not only important to pass the legislation on each of these issues, it is imperative. The Keeping Nurses at the Bedside Act, which by the way, was created with 70 nurses, and of course our political department helping us. But 70 nurses came together with the ideas to create this legislation, is truly homegrown legislation. And you're going to ask, what are the House file? The House file number is 1700 and the Senate file is 1561. Both of these will help us solve the nursing crisis in our hospitals. Minnesota has no shortage of nurses across the state. We have more than 122 licensed registered nurses. Nurses are just unwilling to continue working in unsafe, unsustainable conditions that hospital executives have created. With this bill, we are asking for a voice at the table for all hospitals, union and non-union, to work with hospital administration to develop safe staffing plans. The bill also includes workplace violence prevention measures, student loan forgiveness, and mental health support for medical healthcare workers. Recently, we received the results of our nursing workforce report that focuses on 2,400 nurses left their nursing positions in 2022. What they are doing now and what we would need to change to bring nurses back to the bedside. The results showed that the inadequate staffing was the #1 reason they left. And over 80% of the nurses indicated a willingness to return if the conditions improve. So 80% of 2,400 nurses, I think all of us could say that could help our staffing just a little bit. We also ask you to support Senate File 1681 and House File 402, a bill that puts up regulatory guardrails to prevent consolidation and harmful mergers, like the proposed Sanford-Fairview merger. I now would like to open it to the elected officials to ask us some questions. And I believe Katie and company are going to help do that because you guys have been putting yourself on staff.
So as a reminder, as Mary said, if you have a question and you're an elected official, please put stack in the chat and we'll call on you. Representative Gilman did ask a question already in the chat. Her question is, do you believe the demographics have changed of the volume in people coming into ERs in Minnesota?
The volume is has definitely increased, and a couple other nurses can jump on, but here's the problem. Take St. Paul, where you've closed Bethesda and St. Joe's. Granted, Bethesda didn't have an emergency room, but St. Joe's sure did. And so with every closure, you get more and more stress on all of the other hospitals in the area. And so that's one reason why. And then as people lose their health insurance or don't have health insurance, where do they end up? They end up at the EDs. But any other nurse who wants to jump on and add to this, especially somebody who works in the ED, please do.
I'm Tess. I work at Fairview Southdale, and while I don't work in the ER, I can tell you that my unit is honestly one patient in and out. We can't fill beds fast enough. We have so many patients boarding in our ER that we just simply don't have room for and don't have staff to take care of. So the volume of people that coming in is certainly larger than it has been.
Yeah.
Yeah, this is Sandy. I can attest at St. John's, the ED wait time is ridiculous. And even to go from walking into the lobby to then being able to be triaged and even getting a cart. It's not unheard of to walk through the ED and the carts are lined up in the halls. They're called hallway beds. Mm-hmm. There are no curtains. There is no privacy. You could be on a bedside telemetry monitor because you're there for a heart issue and you need to have that rhythm monitored, but it's not being monitored at a central station where somebody's just devoted to watch all those rhythms. It's whoever has the time and pray to God your nurse who's monitoring you has the time to monitor that. I heard from a nurse who works there that she had to straight cap a patient. She's not going to do that in a hallway. So they have what they call, most ERs have a crash bed where they save it for the ambulances so they can just kind of come in and deal with whatever that issue is. She took that cart with that gentleman on there and wheeled him into the crash bed area to provide him the privacy needed to perform this necessary care, praying that an ambulance didn't come in and just boot him out of the space. But that's where it's at right now. And it's when Steve spoke about how he feels it's dangerous being in the hospital, as a nurse, we are sounding the alarm. It is dangerous. If my loved one was hospitalized, I'm going to be right there at their bedside. Of course, my employer isn't going to be happy about it because I'm going to need to call in sick or whatever. But we really, it's really not that safe. And you want to be there to make sure that they get help to the bathroom, whatever. I'm not saying that the nurses in the hospitals aren't doing the best that we can. We sure are. We're doing everything that we can and we're also trying to protect our licenses and protect our patients. And I think that over the years, I'm sorry, I'm getting on my soapbox, but I've been involved with MNA for a long time. We've gone to the legislature. We hear you need to get this built in your contract. You need to get this done. We go to our negotiations and they say, we're not interested. You're going to have to deal with it at the legislature. So the time is now. We need to be bold. Minnesota needs to take a stand for both their nurses, their healthcare providers, and their community. The time is now. Thank you.
Thank you.
Can I just say thank you for just real quick? This is Representative Gilman. I just want to say thanks for taking time, sharing what's actually happening. It means a lot. The reason I asked about the demographics as well is because in Human Services Finance, where I serve on committee, I'm noticing as we are expanding our support for homelessness, support, things like that. And there's more people that are coming into the state, but a lot leaving as well. I'm just curious if the level of care has come up or if people aren't understanding, what is actually an emergency visit versus a minute clinic visit. I mean, do you find that you have to, things are not, when people are waiting hours and hours and hours, is it because of the volume or is it because of people not understanding the severity of, a cough versus an accident? I'm just trying to understand that. And the second part I just want to throw out there is I'm encouraging, because I'm out in the rural areas. I've been talking with colleges, nursing programs. My niece is in nursing right now, but she even had friends leave nursing to pursue nursing because medical and religious exemptions were not honored, with getting the vaccination. They were open to all other vaccinations, but because, the COVID vaccination wasn't, in certain people's faiths, or, all kinds of things was not tried and true. So they've left that until hopefully that would be lifted. So I'm just encouraging people just to ask those questions as well, is that we've lost a lot of young people that were pursuing nursing because they couldn't get into the local colleges here, but now some are into the cities and different places. Right. But just to find a place of employment. And I've also talked with nurses over in Wisconsin, and their conversations are much different with Sanford than we've been having here. And so with a lot of policies and a lot of big things going through our legislature, where we're going to fully fund, gender reassignments, different things like that. That's big dollars. And I think that's one reason why, as I'm talking to doctors right here in my district, they're concerned. This is all being recorded here. I'm trying to tread lightly. They're just concerned, what are the motivations? Is it to free open, open up, things, or what is it for? So I better just keep it locked down.
Okay.
I mean, you know what I'm saying? Because isn't it sad that we can't be straight up and have a conversation here? But in my district, this is what I'm hearing a lot. And I'm just, I'm concerned if there could be more education around who's like the data, who's filling our ERs, and what can we do to and there's people triaging all the time, but it still takes time, So as people are anyway, I appreciate it. Thank you.
Is it representative or senator? Sorry.
I'm a representative. And this is my home comfortable. I'm home. I made it home safe.
Yeah.
So
yeah, no, that's fine. I will say that, part of why people end up going to the ED is because they're not hooked up into some kind of healthcare system. You know what I mean? If you've got health insurance and you've got an established doctor, it's 9 times out of 10, somebody like me who's got a clinic, and all of us on the call, probably, we wouldn't even think to go to the ED for most of our stuff. So you're going to see a lot of people in the ED, especially, and I work night shift, that down the list, they seem to be small issues, but you never know what it's going to be. And then also in all of our EDs, kind of like what Sandy was saying, all of our emergency room nows are kind of establishing these little rooms where they can kind of push people through, do a test here, EKG there, kind of get them in and out. They're trying to do this kind of increase the triage kind of thing to help with what you're talking about. But I think the main thing is that if people don't have health insurance or aren't clued into the healthcare system, when anything happens to them, they're going to end up in the ED because they don't know. And if you go to a minute clinic, that is out of pocket. If you go to a minute clinic, you got to pay that out of pocket. So monetary reasons would be another reason that somebody would come to the ED, because the ED, if you walk through the doors in Tala, you can't refuse them. So there's, I would have to say that access, whether you have health insurance and your monetary resources are all reasons why someone would go to the ED versus a clinic. We have to move on. That's what Shannon said. So what's the next question?
Representative Norris.
Hey everybody, Representative Matt Norris here. I represent Blaine and Lexington in the Minnesota House. Great to be with you, and thanks for all the critical work that you all do for us throughout our state. And I've been a big champion of the Keeping Nurses at the Bedside Act. Looking forward to hopefully getting that through. And one of the other things that really has me concerned is the workplace violence. And Susan talked a little bit about that, but I'm wondering if somebody can elaborate more about what are some of the things that our hospitals can or really should be doing to try to cut down on the workplace violence that our nurses are suffering.
The biggest, and our National Nurses United have done studies on this, and the work is to increase the staffing. Take a mental health unit, Representative Norris, where you don't have enough staff to be able to do their their therapy sessions, and you don't have the resources. And when you're just trying to keep everything together, but you don't have the resources or enough nurses to run group, etc. That is a huge, that when you've talked to people who work on a mental health unit, that's huge. So staffing and having adequate staffing, having one psych nurse have to take care of 12 patients and see to all their needs is unrealistic. And I would say the same on all of it. So workplace violence is directly to inadequate staffing.
Mary, can I say something?
Yep.
This is Susan Wermter again. When that grid changed, everything changed. I was unable to sit and spend any time with my patients as I had previously. I had been able to go over skills with them, check that they were doing safety planning, all of those types of things, and that went out the window when we changed this grid. And we were not able to staff up properly when we had patients that had a violence history or were highly psychotic we just got, it's not in the grid, it's not in the grid.
Right.
It's very unsafe also on the units when we don't have enough adults around, enough staff around to work with the kids. And it was so frustrating to us because the kids would become traumatized by seeing staff assaulted. And then the other issue is that the community resources have disappeared. So then we would end up with kids on the unit for a month, 2 months, even 3 months, sometimes even, I think our longest was 4 months. I mean, to think of a child or an adolescent on a locked unit, never going anywhere for months, waiting for a placement. So that is an issue also, of course. It happened with the adults too.
And one other thing you should know is that this is the big thing now, Representative Norris, is that all the hospitals are finally getting metal detectors or some kind of because I think they think this is going to be the be all end all. Now, granted, we need to know when weapons are coming into our hospitals, but don't even think for a second that, and they're all getting a new system. We're getting one at North Memorial, but that's not the be all end all. But I kid you not, they're going to act like it's going to be the be all end all. The be all end all is having enough staffing. But
Mary, I'm sorry.
We need to keep it moving. But I hope that answers it. It's staffing. Okay.
This is Sandy. I just want to add one thing. With our Fairview contracts that just went through, our team was able to get language regarding personal, not really a personal safety device, but it's a panic button that staff could wear so that if you found yourself in a situation you couldn't get to a phone, you could at least push this button and it would locate, this is where you are, you need help now. Now, we settled those contracts in December. It's March. Have they looked at them? No. And here we go. Let's just waste time and drag our feet.
Right. And that also took like 6 months into negotiating before they agreed to it. That's something that should have been done the first month. And so anyway, where are we at with questions?
Thank you, Representative Norris, for that question, and Representative Gilman. We don't have any other elected officials on staff. Were there any more questions from our elected officials on the call today? Representative Cagle.
Thank you. I'm just kind of curious, why are patients being stuck in the emergency room hallways when hospitals have beds on other in other units?
Why they're stuck? Usually, if you go to my hospital, all the beds are full. So that's one thing. When you have two major hospitals in the metro area that were closed during the pandemic, that is a lot of hospital beds that are no longer there. And so very seldom, like say North Memorial, we are at the max at like 330. It used to be 280 was like our max. Now we're never below 300. Okay, and every hospital would have this. So you've got that all the beds are full. But then even if you've got an occasional bed, you don't have enough nurses. There's not enough nurses to fill that. And we alluded to, right, just because we have licensed beds doesn't mean we have enough nurses. That's basically what it is. But I will say that every time you've got mergers, and the last one was Fairview Health East, what did they do? Close 2 hospitals during a pandemic. I can't stress enough how that really, really did create a really unsustainable system in the metro area and beyond. Unconscionable is what it was.
And if we keep driving our nurses from the bedside, there's not going to be anyone to staff those beds, right? So as you can see in the chat, most of our nurses say an open bed that isn't staffed isn't an open bed. We just have to bring our nurses back to the bedside.
Right. And we got a few more, Senator Hoffman and a couple other
people.
You see the hands there?
I got it. My hand. Now I got to figure out how to lower this. You know, you got a what is that? A Luddite. I'm a Luddite on this thing. Thank you. Somebody lowered my hand.
I got you, Senator.
You're
I
awesome.
lowered it for you.
Thank you. I'd being flexible. I was in environment and legacy, and all of a sudden I realized that it was, you know, there was a lot of people that I needed to stay. I could not leave that meeting because if you don't hold the line, then something could possibly happen. And so I was there just to make sure I held the line. Speaking of holding lines, it's always been, you know, every time we seem to be having conversations, there's another line. It's like, why do we just keep having these lines put in front of us? And I feel sorry for my nurses that have to always have to go, let's get back on the line, because it's the only way to get attention on things. And I hope people understand what I'm trying to say there. Aaron Hagel, to the point that you just raised, there's reports out there that up to 20% of the beds in hospitals are people that should either be transitional care, assisted living, nursing homes, could be living in their own home with home health care needs or some PCAs or some support, like an RN that pops in every day for an hour and says, how you doing, Jimmy? You taking your meds? The system is failing behind us, and hospitals are a mandated service under Medicaid. There's 15 Medicaid mandated services, right? If you don't have a nursing home availability, where's the only mandated service left? Well, hospitalization, that's a mandated service. So it's just, we've created, Aaron, legislators, the only way we get them out of this problem is that we start to pay those caregivers. And I'll give you an example. Mary Turner, you know this system well. If you are somebody that works in elderly waivered services, your pay is $13.61. I might be off by 20 cents. It's $13.61 or $13.81 an hour. And it's like, how can you sustain that, right? And no wonder why the system, the stress then gets on our nurses, the bedside, getting back to our whole thing about where the stress needs to be. We need to have those standards in place so that nurses feel they're safe, and then they can do their job and be nurses again. The other thing, that nurses aren't just being nurses anymore. I saw some nurses holding slot buckets, that they were also the janitors. They were also the ones that were providing food service to individuals that, you know, that, hey, what about is that a relegated nursing duty or delegated nursing duty, Mary Turner, to have a slot bucket and to clean the bathroom? I mean, and granted, it's because there's a you know, a personnel. We don't have people that are flocking in here, but you know, the thing that gets me, there are 53,000 job openings in the caregiver thing. The only way we get some relief to the nurses, other than making sure that we have some standards in place, I did wordsmith me on the word standards, I don't care, but some actual best practices in place that we're going to actually get behind and hold accountable to people. The system's just going to absolutely collapse. There's a woman at Mercy. Anybody work at Mercy Hospital? 3rd floor Mercy Hospital for 11 months. One woman, master's degree in library science, is one of the smartest people I know when it comes. She can't get out of that place because there isn't a transitional care unit available to hold her unique and individualized needs of her disability. And so it absolutely bothers me that here's this person that I've known for many years, and she happens to be a resident in Coon Rapids. So at least she got to vote for Jim Abler, who was endorsed by the Minnesota Nurses Association. Thank you very much. And absolutely, that's supposed to be funny, Mary. Come on, don't you know?
I am. I'm like, yeah.
but doesn't it? It's so. But Aaron, to your point, I'm glad you brought that up. Why are we looking at that? The system. We need to start supporting the system all over the place. So with that. Mock Manure is going to have a huge ask, and I hope the targets get set. It'll be the same ask I have. I hope the targets get set because we can start alleviating some of those problems in the entire system. Thank you, nurses, for all you do. Thank you. I love you. The best people to have. The best question is, when I did early childhood intervention stuff, I could never get an answer from the academic people at all. It was nurses who said, because when I was a new parent, right, you had to have 5. I thought you had to have 5 vegetables and 5 fruits, right? And I was freaking out because nobody was like, oh my God, my daughter doesn't do this, doesn't do that. And here's this nurse from Ames, Iowa, right? And she said, oh, John, no. Let me explain to you what this means. And then she explained it to me in human language that I understood. And I went, oh my God, there's the expert now doing it. So very early on, I love nurses, and they're going to keep doing what they're doing. That's who you want. That's who you want by your side, because they're going to take care of you. So now I'm done with my speeching.
Well, we always love you, Senator Hoffman. We never doubt that you're in our corner. So we thank you over and over again.
Well, let me get a drink of my water here. I don't know.
Oh my gosh.
So I can just, there, you want to take a picture of that?
Yeah, really. Who else? We have Fia. I want to say that.
Mary, hold on. Sorry. Yeah. So thank you to all the elected officials for your support and your questions and for being on. We really appreciate you all. Were there any questions from the media? We just have a couple minutes and then have to wrap up, and then we'll get some member questions too.
I just wanted to say, if there's any North Memorial ICU nurses on here, thank you so much. About 2 summers ago, about a year and a half ago, I cut my fingers off and was in the ICU for 8 days. And I put in the chat, I was really upset because I couldn't put my hair up in a ponytail. And so the nurses there braided my hair. And it was during a time when there was, you could only have 2 people in the hospital. And so I had a whole week where I didn't see my kiddo or most of my family, and it was those folks that kept me sane there. So just wanted to if any of you guys are on, thank you so much. I was going to send flowers, but I know that can't happen in the ICU. So
yeah, but I work at North Memorial, so I will pass on to the other ICU nurses your thanks, Erin.
Thank you very much.
Yep. Katie,
were there any questions from the media?
Are they still on? Are they?
Okay. So now we'll move to member questions. And we are almost out of time, so we just want to keep these brief and know that all of the members can stick on if you have additional questions after, and we'll stay on for as long as you need to answer all your questions. But we'll start with Patty. You had a stack a long time ago. Do you still have a question?
No, not a question, just a comment. I was just going to add on that, when there's Senator Hoffman talked about that we don't have enough support. We've had patients on our unit for six months, enough support outside in the community. We've had patients on our unit for 6 months at a time. And I would love to invite the executives from the hospital to come follow us and show me how I can do better with my time. When I do have more time, patients need less PRNs. I worked on the unit for 10 years, and if I've got time, I can use less PRNs. The patients need less medications. Anyway, I'm just reiterating what everybody already said. So that's.
Thank you.
Katie?
Thea?
Okay, I have to unmute myself first. But anyway, I was just trying to answer some of Representative Gilman's questions. I don't know if she's still on, but part of the reasons why there's too many people in the ED is because a lot, especially in pediatrics, the parents wait so long because they don't have insurance. And by the time they show up with the kid, they're really sick. And so there's not a whole lot we can do about that. The other one I want to respond to with her is Stanford. Stanford and abortion. I had a personal experience with a family from where they are, Stanford, who had a baby that was premature, and they literally just gave the parents their firstborn child and said the kid was 24 weeks old and they couldn't save the baby, and they walked out and left them in the room with this baby. The baby stayed alive for 2 hours without anybody suctioning or doing anything, and then the baby died. So the next time they got pregnant, they were still having problems with prematurity. They came here, and the baby was delivered. And by the time I met them, that baby was 6 years old. And they had another one that was preemie again that they had here. So just saying that if Stanford comes to Minnesota, the rules probably will be changed because that is what they believe over there. So those are that's what I wanted to comment to respond to her questions or comments.
Thank you. Thank you. Thank you. Katie?
We have Becky Bixby.
Becky?
Hey guys, sorry. I'm homesick today, so hopefully you can hear me okay. I wanted to let people know, I know there's some questions about workplace violence and about, and I'm a big proponent about workplace injuries, because once they happen at the hospital, then they, you know, you're under workers' comp. I injured my back, what was it, 2 years ago, and then got to a point where a year later, I was able to do most nursing duties, and was promised help. And that fell through, got re-injured all the way back again, and had to start over. And I left the bedside 2 weeks ago, not out of choice. Sorry. And I'm probably putting my job at risk by telling you guys this, but this is so important. I was on the negotiating team for St. Luke's, and we got good language for keeping the staffing grids and all that kind of stuff, trying to keep things at a level where it would be safe on the floor. But at the same time, just because you have it on the grid doesn't mean it's enforceable.
Right.
It doesn't mean that other people are watching to make sure that a particular hospital is doing all they can in order to get as many staff into that hospital. The reason I left was because I foresaw myself getting hurt a third time, and I'm not going to sacrifice my back and my family for things that I hold so dear, which are our patients. So I just really believe that keeping nurses at the bedside act is really important for not only, like, you know, the patients in the hospital, but all the way across the board. We need both pieces, not just the contractual piece. We need the legislative piece so that we can work together and actually have really good healthcare in Minnesota. So anyway, thank you for letting me share.
Thank you, Becky. Thank you.
Cindy Dahl.
Hi, everybody. It'll be 44 years in June that I've been a nurse. Nurses are the gatekeepers. We are standing at the bottom of the hill, and we are fielding all the S-balls that come down the line. We can do everything. We can do housekeeping. We should be doing housekeeping if needed. We do dietary. When we don't have enough security people, or auxiliary people, or x-ray people, or transport people, we are the ones who do it. And I love doing it. And so if we take care of families, we take care of doctors, we are the gatekeepers. And so it's really important to have us around, because if we're not around, things are going to fall through the cracks. Thank you.
Cindy, I learned in 2001 when we were heading onto it, and Fairview ended up going on strike, when Abbott was becoming a ghost town. And you know why? Because the nurses weren't going to be there. And I realized then at 3 in the morning that without the nurse, the doors of the hospital close. And no matter how much they want to deny that now and say that we're just a team member, and it's because we can legally do everyone else's job, Senator Hoffman, but they can't legally do ours.
Exactly.
And especially in rural Minnesota, they are doing exactly that, doing all the jobs without any ancillary help. And now it's, well, in our metro too, we're all getting in that situation where they're taking my words and using it against me, because I've been saying that for over a decade, well, 2 decades. Without us, the doors close, and they are taking turning my words against all of us, because that's exactly what they're doing. Katie, anyone else?
Jill LeBron.
Who?
Jill LeBron. If Jill isn't on anymore, Jean, we have one last time for question, and then we'll wrap up with Mary's closing remarks. And then for all the members, you're welcome to stay on. We're going to do a debrief. And so if you have additional questions or comments at that point, it'll be an open conversation for you to express those at that point too.
Thanks. I've got my notes written down, so I'll try to be very concise. I attended the Tuesday hearing. Tina Liebling is the chair. I believe that's health policy. A couple things that came out, and that was for keeping nurses at the bedside, which passed out of committee. A couple that came from the comments in the room from opponents or people concerned and wanting to amend it to eliminate the provision that is about staffing. Somebody said that maximum staffing is the same as having a ratio. I think somebody should consider what they're saying when they say that, because that means what you're saying is there should be no maximum to the amount of patients a nurse can have. And is that really what you want to experience for you or family if you're ever in the hospital, is that your nurse could have an unlimited amount of patients to care for? Maximum staffing just means there should be no more than this many patients assigned to that nurse. And that will vary according to how the nurses and managers, administration decide that their time is best spent with those patients. So please consider that question as being kind of ridiculous to equate maximum level, a maximum amount to the same as a ratio. The other thing is one of the representatives said, you know, when I come into the hospital, I'm a problem causer. I'm a mama bear. I get all up in everybody's face. And you know what she said? So she said, I don't know what would solve that, how this will solve that. And you know, the answer, as we've all said quite clearly, is appropriate staffing will handle anybody's mama bear family. Or if that patient is the, aggressive or agitated person, Susan knows this, we all know this. When there's someone to meet the needs of the patient, then the likelihood that they become violent and don't disrupt the unit and don't hurt themselves or hurt the staff is addressed with adequate staffing. So eliminating that provision number 2 is like counterproductive to her concern. Thirdly, I just also want to speak real briefly about something I'm very concerned about for the merger / actual acquisition of Fairview. Sanford is promoting remote and virtual care as an answer to some of the resource management that they plan to implement. And I'm very concerned that that virtual care and that remote care will be provided to Minnesota patients out of a non-union Sioux Falls, South Dakota. So please ask and consider that if you happen to meet these folks directly and ask questions. I went to many of the AG meetings, and after I think when I got to Grand Rapids, they basically told us in the audience that we could not ask questions directly to the CEOs. So they were being shielded from the public's concern. Even though they were sitting there, we could not speak to them directly. So this is concerning that they want to sit there and listen, but not to respond to our actual concerns. Thanks very much. And I appreciate everyone on call, nurses, media, and our lawmakers. It's great to see you all.
Yeah, and I just to tag onto that before we close up here. I did ask at one of the aides in Worthington, I said, have we solved the broadband issue in Minnesota? Because if we've solved the broadband issue, if I can get on to a call with the students in Morris University and the Zoom call doesn't get disconnected 3 times, or if I can talk to my Duluth nurses and actually see their face and their voice at the same time, then maybe telehealth would have a prayer. But to my knowledge, it's not, can you hear me now, in every corner of Minnesota. So I just wanted to point that out. Is the broadband issue solved? Anyway, thank you all once again for being on this call. Legislators, we call on you now to support legislation this session to fix the nursing crisis in Minnesota and improve the quality of healthcare our patients need and deserve. We look forward to continuing these important conversations and working with you to pass strong healthcare legislation this session. This can, and one last thing is whenever I go to any of these hearings, they're wanting us to compromise. We have compromised enough this decade. That section 2, as far as I'm concerned, is all the more we're going to compromise. but I'm not the one running that show, but that's just my own personal opinion, because I keep telling them, I keep hearing how they want us to compromise further. We have compromised much over the last decade. So once again, thank you all for being on, and back to you, Katie.
Now we ask anyone who isn't a member of MNA or a staff person to please leave the call. This is closed. So thank you all so much for your attendance. And we'll just give a few minutes for folks to drop off. It does look like most of the folks who aren't MNA members have left. Just a couple left.